my goal is not to save these people just from chronic pain, but from the medical system, because the medical system is misdiagnosing these people, and even the most prestigious hospitals in the United States are misdiagnosing these people. Hey everybody, what's up? Physical therapist Dr. Ryan Whelton, coming to you from just outside the very hot Tampa Bay area. If you're new to following me, I got a clinic where most people have failed everything type thing. Anyways, you can download my courses at wheltonmethods.com. I'm also now on Spotify at Whelton Methods. I am on Apple Podcasts, Whelton Methods, more in-depth. I go more in-depth into these issues. YouTube, Whelton Methods, and every social media platform, Whelton Methods. So, okay, so today we are talking about the Slump test and how it's not as good as a test as you think it is, okay? And how you can actually trick yourself using the Slump test, okay? So, the Slump test is when someone herniates a disc or they have a nerve pathology in their back, nerve lesion, whatever, they bring their leg up, right? And if they have, and point their toes back as they're slumped over, and if they have pain in their leg or can't extend their leg or have back pain, then it is indicative of a nerve lesion in their back, sciatic-like symptoms. I have had a herniated disc in my life, in my back, and I couldn't lift my leg up like more than, it got to about 45 degrees because there was so much nerve tension in there. Now, what I noticed over the years, after I figured out SI joint dysfunction, so SI joint dysfunction is, I published it at wheltonmethods.com. I published a paper in 2020 called Root Cause of SI joint dysfunction, okay? I show you what causes it and how to realign it, okay? But when I figured out SI, that it was caused by an upslip and or outflare, okay? When I figured out SI, I started opening up people's SIs up left and right, open up their SIs up. And the strangest things started to happen with my patients. So, just today, I saw somebody without back pain who came in, back pain is not an issue, came in with just lateral shin pain. And I opened up the SI, boom, relieved it. And like nobody could figure it out type thing, right? I just evaluated a patient that had just buttock pain, but had severe nerve root impingement, L4 through S1 nerve roots, right? Severe impingement of those nerve roots. So, of course, the medical profession writes it off as nerve root issues, right? And another patient that I talk about all the time, that a lot of my patients get referred to psychiatrists with these mechanical issues, and one today, I'm telling you, it's totally bonkers what happens to these people. Totally bonkers. And it's a tragedy, and that's why I scream about this and I'm passionate about it, is because of the crap I hear all day long about what they did to these people. So, and I started opening it up. I started seeing some really strange things that aren't documented in medical history. I started seeing, I colored this in here, and the groin region. I see testicular pain that's not Cauda-Equina syndrome. They had the MRI cleared. I started to see foot drop. I have 2 videos at Whelton Methods on my YouTube channel that you can watch. I think I call it Patient Makes Medical History. And you can see me get foot drop to 5 out of 5 strength in real time. Watch me do it by opening up an SI joint. And that shocked me when I saw that. I have seen people that have had genetic testing at the most prestigious hospitals in the US, because 1/3 of their thigh, that one thigh is 1/3 of the size of the other one, and nobody can figure it out. And I open up their SI and realign their SI, open it up, and they can't come out of a single leg squat, and then I hold it open and then boom, they pop right back up. And it's like, no, that was it, because it can cause weakness and therefore atrophy. Okay, so I always tell people, from anybody with any symptoms from lower thoracic to into the foot, to screen for SI, okay? Because if you do not screen these people, you should see what happens to them, because it is a tragedy like you have never seen. When I wrote that the root cause of sacral torsion, shear, anterior sacral tilt, again on my website, wheltonmethods.com, I made sure, I wanted to get it out to my colleagues as to like, hey man, these people are talking about ending it all. And they sit and they cry and they tell me they don't want to, they can't sleep, they can't do anything, and when it gets really severe, right? And I'm like, and no one really is really taking this seriously, and so anyway, so I asked those 19 patients that I outlined in that paper, have you thought about ending it all? And 57% said yeah. So I put that in there so people would take that serious as to like, hey man, like this is not something like I don't feel like it today type thing. If you miss this, currently in our medical system, it's usually going to get missed. Okay. So anyways, that's that. So one of the things that gets misdiagnosed is SI joint dysfunction when it comes to the slump test. So people just blanket think that if someone has back pain, then if they have a positive slump test, then it's a herniated disc. But when I figured out SI, I started opening SIs up, and I was like, that's strange, and I'm like, their back pain went away and their slump test went to negative when I opened up their SI and realigned it. And I was like, so the slump test to me is now only positive if the person can't extend out, like I was saying. So they can't extend their leg. They get to like 45 degrees and it's just like, and then pain in the center of the spine. If they're pointing to pain over here at their SI when you do the slump test, and you need to look too. So when someone goes like this, and I do a slump test with someone, which I always do for back pain, when I do a slump test and they say, yeah, it hurts in my back, I literally lean around and say where, so I can look, because if they're pointing to the center of their spine, it's probably a herniated disc type thing. But if they're pointing to their SI, you're just shearing their SI, and that's why it hurts. So you're going to diagnose them with a herniated disc, even though they might not even have a herniated disc, okay? And then the whole thing just gets all convoluted, okay? So what you're doing is like, think about it. If the person has an upslip and an outflare causing SI, and you pick their leg up, it's gonna hurt at their SI. So the slump test that you think is a neurological test is really not. It's actually shearing bone pain, and then the person says they have back pain, and everybody thinks that they have a positive slump test. No, you just sheared their SI joint, just kind of like a quadrant test, like you just sheared it. So you can't really say that, And the more you do this, and the more that you use my diagnostic procedure that I published, the more you'll start to see these crazy things happen in your clinic that aren't documented and people just don't know about. But the interesting thing that I found was that when it comes to the slump test, I would have somebody with a positive slump test. And for some reason, I don't know why I did it, is I would realign their SI joint and then I would check them again. And when I checked them again, they didn't have a positive slump test. And I was like, not every time, but there was a good amount of, good percentage of people, I would say, that went from positive to negative by realigning their SI joint. And I'm like, man, people are just getting misdiagnosed left and right, because this shocked me, and I wrote wrote a paper, root cause of SI joint dysfunction. So the more you do this, the more you start to see that our current understanding of low back pain and radiculopathy and how to diagnose it is not accurate. The most common cause, if you do not believe me, I published a paper for free on my website, wheltonmethods.com, called Root Cause of SI Joint Dysfunction. Plus I go more in depth in my YouTube channel, and I show you how to open these things up, and on Spotify too, how to open it up and hold it in alignment. And when you hold it open and the person's pain's gone in their back or their quote unquote radiculopathy, then you start to realize that, this wasn't what I thought it was. You know what I'm saying? So it's pretty bonkers what the SI joint can cause and what it can mimic. I have seen knee pain. They either have back pain or they don't have back pain, and they say, my knees are killing me, and they're like, I had knee surgery. They scoped them, and I'm like, first question out of my mouth is, what did your knee surgeon say? They said it was a success, and they're like, my knees are killing me, and I'm like, So sometimes I'll ask them, but it doesn't have to be this way. Does your knees hurt when your back hurts? Do you have back pain? Yeah, sometimes. Does your knees hurt when your back hurts? Yeah. At the same time? Yeah. It doesn't have to be that way. I saw somebody today that didn't have back pain, but it had, shin pain, So, and then you open up their SIs, and then it brings into a whole new question in your mind about who to trust in this medical system. Recently, a family member, one of my nieces, got hurt, and I told my family member that, hey, listen, it was my sister. She could not believe that she was getting all these different opinions, about what was wrong. It was fractured, it wasn't fractured, they put it in a cast, they put it in a sling, they told her to go to physical therapy, all these different opinions. And I'm like, yeah, welcome to medicine. I'm like, this is how it works. And I'm like, if they want to do surgery, which the child had a fracture, if they want to do surgery, I'm like, get 3 opinions. And she's like, and then one surgeon wanted to go in and just cut the whole thing for a bone chip. And then the other surgeon called that surgeon crazy and said, I just need a scope and pull it out. Bonkers, man, totally bonkers. When I met Dr. Norm Shealy, he told me, he's passed recently, but he told me, your best bet, Ryan, is to stay away from the medical system. This is a neurosurgeon, retired neurosurgeon, right? And one of the greatest medical minds ever. And in my head, I didn't say it out loud, but in my head, I was like, isn't that a little harsh, And I'm like, but then I started he had a clinic where most people had failed everything, and he could get 90% of them off drugs and healed, and from medical issues. And then I started to realize that that's what I was doing in here, and it wasn't just here, it was also in medicine too, and general medicine too, that this craziness happens where these people come in and they've been misdiagnosed and filleted and butchered and all that stuff, and and told this, that, and the other thing, and I started to realize that he was right, and I became a very skeptical patient, very skeptical about what doctors are saying. And you should be skeptical, and you should get multiple opinions, and they will be usually opinions. It's totally bonkers. But when you do a slump test, make sure you look back. When the person lifts their leg up, look in their back and see where it's hurting. If it's hurting in the center of their back or on the side at their SI joint, if they're pointing to their SI joint, you're just shearing their SI joint. If they're pointing to the center of their back, then that is more slump test. Or if they can't extend their leg all the way out, like I couldn't when I hurt my back because of nerve tension, then that's a true slump test. But start opening up SI joints and start seeing this craziness. these crazy referred pain patterns, So anyways, that's that. I have a cool announcement. I am going to publish another paper. It's been a while since I published a paper. So I published Root Cause of SI Joint Dysfunction in 2020. And that is on my website, wheltonmethods.com. And then after that, I published Root Cause of Sacral Torsion, Shear Anterior Sacral Tilt, where I streamlined that evaluation process and streamlined the evaluation process and then made it much easier to diagnose, way too complex the way they teach it in school. And then I also figured out that you don't need to know everything. Like in school, they teach you, right on left, left on right, right on right, left on left. You don't need to know that. And you don't need to assess them in sitting. You don't need to assess them in standing. You don't need to assess them in prone. And none of that, like they'll tell you that in these advanced manual courses that means something. It doesn't mean anything clinically. And I say that like you try what I wrote up. All you need to know is which side the ILA dips, whether it's extension, whether it's sitting flexion, whether it's standing flexion. And the kicker is that it's almost always your left thumb will dip in because it's rotated that way, okay? And the reason why is because there's an imbalance in the piriformis muscles on both sides. And you need to, if you can check it too, and you should check it, is to flip them back over in a 90-90 test their left piriformis, they'll be full strength, and test their right piriformis, and you'll see a massive weakness. And then you just confirm to yourself what to do. You strengthen the right piriformis. I've only seen five in my entire career left piriformises that I had to strengthen. If you're going to tell me that you have to send me the video, I want to see it, okay? Because I do this all day, thousands of people, and it's always the right piriformis. It's always the left thumb dipping in, when I talk about sacral dysfunctions, like I just put like right sacral torsion. Like I don't do right on right, but like it doesn't matter to me. Like that doesn't matter clinically to me to how to get somebody better when it comes to sacral dysfunctions. So I just say, it's facing that way, so it's right type thing. Is I believe the way they label it. Anyways, that's that. But I'm going to publish another paper. Along with the ones I published. I published another paper on shoulders, on posterior shoulder impingement syndrome. And then I'm going to publish another paper coming up. This summer I'll do it when I get some time. And I'll sit down and I've actually written it. I forgot I had written the paper. It's like ready to go. And I just never finished it. So it'll be pretty cool, very insightful. I think people will be shocked at the causation of this, and I will leave you in suspense as to what I am actually publishing and this effective protocol that proves what's causing it, which is a mystery to the medical system that I found. And I'm also going to outline a few other conditions in there that's the causation of it as well. So, anyways, if you want to take my courses and start getting results, wheltonmethods.com. I got my rehab results course, which is my orthopedic protocols. I give you everything, sets, reps, everything. Here's how I get the results I get. I got my in-depth myofascial, my online beginner myofascial, and my intro shoulder. The intro shoulder is money back guarantee. And that's like 1,000 pages of maps of the body. Where I map different parts of the body that connect to other parts of the body. I saw a guy in Luxembourg who's an awesome PT who actually advertises that on his website. 90% of people feel immediate relief of their pain on the first visit, which is awesome. I mean, can you imagine that as a business owner being able to advertise that? Doctors can't advertise that. Orthopedic surgeons can't advertise that, And it's natural too. People want natural. They don't want, to be injected the wazoo, right? So, and then I have my membership, which I'm changing, and we're going to create a community, okay? Where I'm going to get on and I'm going to be able to interact. Because over the years, people have had a lot of questions for me in terms of like, hey, I got this patient. What do I do about this? But but I'm going to do live Zoom calls where you can even bring in your patient and we'll all learn from it and go over how to diagnose, how to treat it, and I'll teach, and you can ask me questions, and we can talk. So it'd be really cool. Check out my website, wheltonmethods.com, if this has been launched. Okay, those are for people that want to take their game to the next level. My goal is to get people diagnostically there, to be able to understand how to diagnose these different issues, and then apply my protocol, and patients should get better. So there's that, and then I also have my my business course where I teach people how to open and run a cash-based business based on my methods. So pretty cool. So there's a lot of changes coming to Whelton Methods. I'm really excited about it, and I cannot wait. But slump tests, don't trust that it's just neurological, because you have to check where they're pointing to. If they're pointing to their SI, you are shearing it, and it is telling you something different, that the person has SI. Open up their SI, realign it, and you will know right then and there. And then hold it open. Watch my other videos at wheltonmethods.com or Whelton Methods on YouTube or Spotify, where I teach you how to open it up and how to troubleshoot it. And you'll see that you'll know right then and there. And then you can rule so much out, just by ruling out certain things. I'll teach that more in this community that I'm creating on how to diagnose and how to diagnose without an MRI, how to diagnose a herniated disc, because there would be nothing left. You've just ruled everything out, so anyways, that's that. But other than that, peace, love you all.